Thank you for tuning into the Minds Over Murder for our bonus episode. We are the hosts,
Evan,
Kendall,
Shep,
and myself, Zach, who thoroughly investigate the flaws in mental health care systems and determine how we can change the system to provide this access. So in our last two episodes, we discussed the cases of Andrea Yates and James Holmes. So in this bonus episode, we will use those cases and others as examples to emphasize our stance on mental health, discussing the current state of mental health care access, and how certain mental health care has helped people. We will also provide solutions and explain how our viewers can relate this topic to their lives. Now, before we begin, a statistic we found was that almost a quarter of adults, 24.7%, with a mental illness reported that they were not able to receive the mental illness treatment they needed. This number has not declined since 2011. This is Minds Over Murder.
So let's talk about the current state of mental health. America has seen a rise in mental health awareness. However, mental illness patients haven't received the support that they've needed. 21% of adults are experiencing a mental illness, which is equivalent to about 50 million Americans. That's basically the population of South Korea. 55% of these adults are forced to battle everyday life uncomfortably due to an absence of this health care. Teens may experience mood swings from depression, people's anxiety can skyrocket, or mental stability can lead them to commit unforgivable crimes like Andrea Yates and James Holmes. Did you know that 16% of youth suffered from a depressive episode in 2023? Yeah, 60% of children never end up receiving any mental illness treatment, period. With the way our society favors mental health over physical health, there is no reason for mental illness patients to be stripped from resources that could lead them to a more comfortable life.
Diving into the access to mental health care is no secret that getting mental health care in America can feel like navigating a maze blindfolded. The trouble with access to mental health providers compared to other medical professionals is that it's harder to find mental health support when you need it. While it's easier to find doctors for physical health, finding mental health professionals is the real challenge, which makes it tough for people to get the help they need for their mental well-being.
Also, from an academic journal, which you can find on our website, some common obstacles for Americans that I highlighted were the high healthcare costs or people just having poor healthcare insurance.
I agree. Looking for a mental health professional is like finding a needle in a haystack, you know? Even when you have found someone, they're often out of network hitting you with an expensive bill. I even stumbled across this source that breaks down what I'm talking about in a really comprehensive way. The link is in our website. It is like your go-to guide, giving you the lowdown on different conditions and how to cope. But seriously, we're talking about folks not having the same access to mental health professions as they do with other doctors. It's like, hello, why is there a VIP line for physical health and not for mental health, you know? Let's talk about the out-of-network nightmare. Some of these mentally ill people are playing financial roulette just to get the support they need. But yeah, big shout out to the link for giving us info and insights on mental health and advocating for better access to care. So we could look at this from outside the box, and everybody deserves quality support without jumping through hoops.
Exactly, Zach. It's not only about individual challenges. There are structural challenges to overcome. We need policies to make mental health care as accessible and inexpensive as possible. It's unfair that individuals have to go through hoops or experience financial hardship simply to obtain the help that they need. Certain groups such as marginalized populations, minorities, and those with low incomes may experience difficulties with mental health care because of factors such as financial circumstances, cultural barriers, and a lack of culturally appropriate services. Even in the case of Andrea Yates that we've been talking about in these past episodes, she had a history of mental health issues, including postpartum depression and psychosis. From the article that I found in the APA, which we have linked in our website, it really explains that despite concerns about her mental health, opportunities for early intervention and proper therapy failed, possibly avoiding her tragic crimes.
Both of you guys make great points. I personally feel like mental health access needs to be magnified so not only our generation, but future generations won't have to search for answers. We can obviously see how mental health awareness has become amplified over the past 5 years. But if we don't provide access and ways to overcome these access barriers or obstacles, then it's basically pointless.
A study published by the Trans-American Institute shows that the best treatments are up to 90% effective in reducing symptoms of its patients. An article published by the Happier Lives Institute, stating the Trans-American Institute, says that only about 20% of Americans with known mental illness actually seek out the treatment. These numbers do not line up how they should. If a treatment is known to be effective, more people should be trying to get it. There must be some other reason for why people are not actively trying to get the help they need. Experts believe that switching treatment to a community-based approach would increase the number of successful cases. This would also help increase the general public's understanding of mental health and reduce stigma around it. This could help the movement to introduce mental health care into the primary health care status, helping reduce cost of medicine and other treatments. The hardest part of fixing a problem of this scale is making the money work. The United States already spends too much money, and adding to other expenses is not the solution. The majority of mental health spending in the U.S. goes to psychiatric care, which is not proven to work, at least not as effectively as other forms of care. The solution is to spend the money more wisely, spending less on hospitals designed to essentially babysit adults, and spend it more to create community programs. Once these plans are in place, they will cost less to maintain and are proven to be more effective than traditional treatments. And for those who still want to and need to take medication, their insurance will now cover the cost, at least to an extent.
I also believe that switching to a community-based approach for mental health could be a game changer. It not only helps more people get the right kind of support, but also gets rid of that stubborn stigma. Integrating mental health into primary care, it just makes sense. I recently discovered an inspiring story on PBS. It's about John Nash, the mathematician whose life is depicted in the film A Beautiful Mind. His story is remarkable, actually. He fought schizophrenia his whole life, but recently suitable mental health care, including medication and therapy. Those therapies were critical in allowing him to control his symptoms and live a productive life despite his mental illness. Nash's experience demonstrates how therapy and treatment may have been a beneficial influence on someone's life, directing them in the right direction rather than leading to negative outcomes that we have been seeing with mental health when people don't have the same access to treatment. It's definitely worth a look for anybody interested in learning how support and therapy may make a big impact.
Another example of an everyday person overcoming their mental illness was a world record-holding swimmer by the name of Michael Phelps. Believe it or not, Michael battled anxiety and depression for nearly 17 years. He spoke out about mental health saying, "We're supposed to be big, macho, physically strong human beings, but this isn't a weakness. We're seeking and reaching for help." With consistency in counseling and treatment, Michael's mental balance was regained. He did have concern about the stigma around mental health, claiming, "That's something we deal with every day. I think people actually finally understand that it's real. People are talking about it, and I think it is the only way that it can change."
And with what Evan is talking about, I believe that by publicly discussing his challenges, he broke the silence surrounding mental health concerns. His campaign stressed the value of getting treatment and fighting the stigma associated with mental illness. Phelps restored his mental state after regular therapy and treatment, demonstrating that even the greatest athletes can confront and conquer challenges that they are faced with.
Some sources we wanted to provide for our audience is the Mental Health Hotline, which is 844-737-5576, and the Suicide and Crisis Lifeline, which is 988. Again, the Mental Health Hotline number is 844-737-5576, and the Suicide and Crisis Lifeline is 988.
We appreciate you for tuning in to our bonus episode. In the next upcoming episode of Minds of a Murder, we will talk about mental health sentencing, punishment versus treatment, going in depth with how mentally ill patients who commit crimes should be sentenced. So yeah, you should definitely stay tuned for that. We are your hosts,
Evan,
Kendall,
Shep,
and Zach, and remember, this is Minds of a Murder.